we're here at Kaiser Permanente, and we have the fortunate opportunity to talk to someone who's doing digital health for all Kaiser Permanente, and essentially this person is the buyer. So for all of you guys that are trying to figure out what the next big app is, or how can my company actually get a contract with Kaiser, or what's really happening at a large integrated delivery system like Kaiser, you're gonna learn a little bit about that. So hopefully you guys jump in. We want to try to make this interactive because we know everybody's kind of on their way out. It's been a long day. A couple people are sticking around for the startup competition announcement. So look lively. All of you guys look like you're about ready to go to sleep. Woo! Come on. All right, well first, let me actually have Nico introduce himself. Why don't you tell us, before we get into what your job specifically is, everybody here has got to know what Kaiser Permanente does, but just give us the big badass stats. Like, tell us a little bit about Kaiser.
So we are the largest nonprofit healthcare in the country, in the United States. We have 10.2 million members. We have 38 hospitals, 600 clinics, just for a few stats there.
That's insane. Do you guys know how big that is? Really? And you guys are divided up by many different regions, right? Talk a little bit about the health plan and the medical group side.
Right, so we have health plan, we have hospitals, and we have the med groups. And the health plan hospital side is the not-for-profit side, and the med group side is actually for-profit. They actually generate money. And then we also operate within 8 states, including the District of Columbia.
Wow. So, I mean, from an IT perspective, this is a massive enterprise that needs to be efficient, effective, and clinically correct, right?
Absolutely, every day.
And that's partly your job, right?
It's to help and bring in that favor of digital into that care delivery process, yes.
Yeah, so tell us a little bit about what your job is today and how you got there. Like, how did you land in this job? Tell us a little bit about your background.
It was a little bit of an accident.
Yeah?
So I actually was wanting to be a doctor. Thought that's what I was meant to be, and then I started working in the emergency room as a paramedic. And started seeing the challenges with communications within the ER. They're still there today, by the way. So lots of opportunity. And really quickly just decided that my hobby, computers, was really a passion, and I could actually start to look at workflow redesign with technology, and that's where I took off. That was now 20 years ago at Kaiser, and I've been leading operations in Colorado. I've done the IT strategy for wireless across every one of the facilities I just mentioned, and now do digital health.
Wow, and so in the organization, you're on the global corporate IT side, and talk to about where do you sit in the organization? Who do you report up to? Where does your budget come from?
Sure. So I sit in IT, report up all the way up to the CIO, but my SVP, who's Wendy Lee, who's over digital technology, I report into that group, and we focus across the entire company, all regions, all our members are consumers, as well as every physician and nurse that operates.
And are you looking for IT solutions that are going to help all facets of your so it's not just how do we communicate better with patients, how do we do a better job on clinical, but you're looking for how do we be a better payer? I mean, talk a little bit about all the different facets of the business that you have to serve.
Well, I mean, you can think of any industry. So at Kaiser, we're very large, and you have transportation. So how do we make transportation needs both of the workforce better? How do you make the transaction or communications of the workforce better? That all leads to how do we talk to our members better? So I mean, if you think of inside out or outside in, it's looking at every one of those workflows, logistics, supply chain. I look at multiple opportunities to improve across all of those spectrums.
Just in the audience here, how many people have either been a Kaiser member at one point or have seen a Kaiser doctor? Raise your hand. That's incredible. Awesome. How many people here have actually used, is it still called KP Connect?
KP.org.
KP.org. So how many people have used it, essentially gone online? Okay, great. Anybody here download a mobile app from KP? Okay, yeah, one person, excellent. Tell us, you are a digital health leader. I mean, Kaiser Permanente has invested a ton. Clearly, you've been using Epic for a really long time. Talk to us a little bit about why you're a leader.
Well, you mentioned one, right? We launched the EHR. That journey started in 2004. So it's rolled out across every hospital and facility.
Wow.
So that's a big achievement in itself. But that's ongoing. I think then we continue to drive our digital assets through KP.org, which we have roughly 70% of the 10.2 million members registered for it. Wow. We have 2.3 downloads on iOS and Android of our mobile app, all using it for secure chat, our email, talking to your doctor, tens of thousands of, millions of transactions for medication or prescription refills.
Right.
So that's all online, all the time access to every one of our members.
And you guys are starting to do video consults now too. You're totally
Integrated video visits on mobile and web and rolled out across all regions.
This is huge. I mean, so, you know, they were early days with Epic. I think the story goes that you guys did try to build your own EHR at first. Was that
I think 2 or 3 times, yeah.
2 or 3 times. And then you went to Epic. You're one of Epic's largest customers, right? But talk to us just a little bit about, I mean, that's really hard to actually get every region up and running. What are some of the challenges in today's world around trying to actually bring clinicians into the mobile age and deliver real-time data at the point of care, and some of the things that you're sort of thinking about on that side, being at Kaiser?
And I don't think they're that much different than 2004. I mean, you have demographics of doctors. Doctors spend, their training and education providing care in a specific way. They're actually trained at this, right? And that's different than the introduction of digital into their lives or their workflows of how they're educated to take care of a member, especially in primary care. So how do we say, here's a technology set, a computer, and if you're looking at an older demographic, they didn't learn typing in high school or college. So it's a pain in the butt for them, right? And so these simple things, even though you might have the best idea or the best technology or the best app, if that doesn't fix what they're used to doing, it's not helpful to them, and so they abandon or they won't adopt it or use it. So behavior change we talk about in with people and us in the community, it's just as hard or difficult with the providers or the clinical operations.
Right. From a thematic standpoint, as far as innovation goes, what are you seeing at Kaiser are some of the areas or the themes that you guys are investing in from an innovation standpoint?
Yeah, I don't know if it's any one theme. I think when we look at things, we're looking at what can provide access to care, what can make it more affordable, what can make it more convenient, how do we personalize your experience? We don't want it to be about an insurance experience or come up to a window, take a number, what's your name, give me your copay. I think we really want to say, do you need to come in, right? Is it better serving us at your house? Somebody was just actually giving me a kind of a kudo about Kaiser the other day. And it was at dinner last night, and they were saying, with your physical therapy appointments now, after you've come in the appropriate amount of times, you don't have to come in anymore. So if you are disabled or you're disabled by the incident that you have for physical therapy, we do a video visit. And it's usually a 5-minute video consult, right? Rotation, how you're doing, how's your movement, your gait, whatever those things are. And that could take you, depending on where you live, an hour or 2 just to get there, right, and come back. So do we really want to put that impact on our members? I'd say no.
So it's access, it's personalization, right? And then I know you've been really personally involved in just improving workflow overall. Talk a little bit about that. I mean, that's some of the unsexy stuff. We've seen a lot of hot startups here that have like this sort of the next killer app, but the reality is that healthcare still has a lot of difficult and manual workflows. What's been your experience? I mean, you've got how many years at Kaiser now?
21 next month.
Woo! That's insane. Woo!
Yeah. So yeah, we had, those who know Kaiser, we build hospitals and we build clinics, and a lot of times what we're good at doing is that they're templated. And then going to Southern California over the last year, we've been looking at an opportunity of how do we more personalize and make the experience more convenient for our members. So we've integrated 14 technologies into the beginning of these new medical office buildings, and it's really just to that point, like how do we do that improves the access, the personalized experience for our members. But what we learned quickly is that those things are the easy part of implementing them. It's actually changing all the front end, the back office, the arrangement, the office size, how doctors actually check in and out patients. It's all what used to be paper flow and digitizing that. It's all of that work that's the difficult part. That's the sausage. That's the sausage,
right? Anybody here in the audience have more of a workflow back office company? Okay, stand up. Yeah. Are you currently selling to Kaiser Permanente?
No, we are selling to Mount Sinai kind of organizations, not to Kaiser. We do efficiency in operating rooms.
Okay, so you're in the operating room and you do OR efficiency.
Yeah, it's really hardcore workflow stuff.
Yes, I'm familiar with that. It is very, very hard workflow stuff. So, okay, here's a great example. So, Nico, there's lots of ways that companies approach Kaiser. You've got your regional innovation officers, you're at the corporate level, global IT. Tell us a little bit about how a company, what's the name of your company?
It's called Core Mobile.
Code Mobile?
Core Mobile.
Can you guys hear it? I can't hear it. Core Mobile.
Yeah.
Okay, so I'm working with him. I'm at Core Mobile, and I want to figure out a way. First of all, I need to do diligence on what you're using in your OR suites, and if it's different in each region. Let's say I get a regional contact, or I get you. Walk us through a little bit of what that process would look like.
I think it's the engagement is the important part. I think it's also understanding us as a company and what our problems might be, or what problem statement you're trying to solve. I think that's the first thing. You look at use cases at a regional level, and that's a great place to start because they're living and breathing, whether it's at the hospital, the clinic level, or if it's like home care or in the OR, whatever it is. I think you need to understand really what their challenges are there, and they vary from hospital, even in Southern California is very large, right? Even from location to location across San Diego may be very different from the access of care than central Los Angeles. So knowing that I think is really important. And then really making a relationship with that local innovation hunter. They all report up in or connected to our national innovation team. And that's one of my peers, so we communicate all the time. So I think that's a great starting point.
And I've been on a couple boards when I was back in my venture days before I went to Box, and a couple of our startups would get in with Kaiser at a regional level, and there would be a security audit and a procurement process, and you guys are huge, the scale that you require. Tell us a little bit, that's a little daunting for a startup. So what are some of the things that a startup should think about if they're going to be doing a pilot or business with you?
It depends on, the answer is depends. It can be easy or it can be hard. It depends on the scale of what you want to do the pilot. And my personal opinion and how I approach many of these things is, MVP, let's start with a very small, manageable way of proving what your outcome or the capability you want to prove. And let's start there. That will simplify the procurement, the legal, remove any investment on both sides. Because at the end of the day, it's always going to cost KP money to run a pilot, even if the partner is giving it away for free. Because for us, it's a national IT organization working with a local facility who has a separate budget and separate people that need to actually come in. And then we end up having to come up with funds internally to say, is this the right pilot and should we do it? Even though it could be the best thing in the world. I think that's the struggle. So how do we make it small enough and prove out outcomes really fast so that we can continue on?
Yeah, it's funny. I don't know if you guys remember, but Amir Rubin was the CEO of Stanford Hospital and Clinics, which is now called Stanford Healthcare. And he used to say, for every free pilot that I do with a startup, it costs me $1 million in man hours and time, right? And it's true, right?
Yeah.
Operationally, it's very challenging to actually dedicate those resources.
That's exactly, yeah. And then all the other stuff, SOC, compliance, cloud, whatever, we do a strong vetting process across that. There's a streamlined version, and then if you really want to go big, then it's, it can be arduous.
So I know we've got these short, kind of quick panels. Who in the audience has a question? Anybody? Okay, we got you. We'll get you in a minute. Come to the mic. Stand up. Tell us who you are. I know who you are, but say it anyways.
I'm Rebecca Grevman. I'm curious how you decide, and maybe this is more of a physical innovation, but when to build something in-house using our Field Center for Innovation versus looking for outside solutions.
Did everybody hear that question? The question was, when do you build something in-house around an innovative initiative, and when do you go outside?
So I think that our core competence is healthcare, and everything that you're doing in technology is your competence. And we should look to you as much as possible to do that as a first approach. And we think that way all the time. I think where it becomes a challenge is that when we have all these legacy systems still, right? And if you guys know healthcare, most of the systems that run scheduling and patient load, all the demographic stuff are mostly still built from mainframes, and they've been refixed, and our ability to move them to the cloud or web services or make them mobile or web friendly is a huge uplifting. And so a lot of times those are the decision points internally to say, well, how do I talk to this system? Because a long time ago we wrote it ourselves. So I think those are usually the trigger points, at least for us. More and more, though, we're looking to advance that, and that's coming. I think over the next 3 to 5 years, that'll be a much better place for us.
Yeah, go ahead.
So actually that was one of the questions, because we generally go into hospitals and we are competing with their internal organizations who have built the software but have not maintained it or upgraded it, and now they can't do it themselves. So you just answered that question saying you would like others to do it for you. Was that right interpretation of your answer?
Well, I think on a services side and who's doing the integration, I wouldn't say that was what I was saying. I was saying that if you are building something that we need that makes our access or our services better, or our systems better, then we're going to look to you as a core, the subject matter expert in that field to do that for us.
Okay, so thank you. Yeah, and the second question is, You said there is an innovation center, and there you can contact any of them. We don't know any of you. Can I start with you?
Sure.
Okay, thank you.
I'll send you to one of my team members. I think I see one.
That's why we do these presentations, because it's, people want to kind of get access and learn. Sort of speaking to that, I mean, given that you've been on the delivery side and what would be some of your advice to people sitting in the audience that are very early stage? They have a new digital health app. We've got folks here that are doing, population health, patient education. They're all sort of, chasing the shared risk value-based model. You guys have been doing it for years. What would be your advice? What were some of the things that you would say?
Yeah, I think the things that I've learned across, doing pilots and with many startups, it's usually not the product or the technology. It's usually the operational model. So just take a remote monitoring application, for example. You have the best app. It's mobile. It's so easy to deploy, but the person's house doesn't have great internet connectivity, Or to set it up takes an IT person or multiple IT people. And the home health nurse or the palliative care person that's out there doesn't know jack diddly about technology. So you have this level of how do I get it to do what it needs to do to prove it, and it's really the operation support to get it to make it work. And usually that's one of the hardest parts in those kind of instances. I would also say that what I talked about earlier, it's like when you think about how you're going to come into the clinical operating model, whether it's a doctor or a nurse or clinical staff, you have to think about what their perspective is and how it's their learning curve, their ability to, or reticence to accept it and take it in. You have to make that easy for them. You could have the best UI or usability, but you have to get beyond like how would it make, why would I want to go do that? I already got something that's working for me. It may not be good in your perspective, but it's good enough for them. So I think that's the measure of what you want to look at of how do I get to that point? That's
excellent. I know just from my own experience in trying to do, startups or VC, I think that the operational piece is so missing. I mean, we're always chasing sort of the next big sexy thing, and there's always execution risk, right? Particularly in the remote monitoring and or patient ed space. And if you look at the EHRs today, they suck, particularly on the acute care side. They're very challenging on usability and UI, but it is sort of, is this good enough for me? Am I getting by, right? I don't know.
No, totally. The other thing I would add is that, so I mentioned we have 38 hospitals and 600 medical office buildings. We look at these opportunities. I mean, it's great to pilot, but really, we have this term inside KP. It's called pilotitis too. It's a chronic condition in itself. So there's only so much we can do about it, and we really want to when there's something good, we want to scale it. And to scale it, that's what you should be looking at: is how are you going to make us scale? Because that's where we want to take it. We want to take it across every region.
That's awesome. Who else has a question? Anybody? Dave, I know you have something. You're sitting on something. You want to sell to Kaiser.
I liked your pilotitis statement. Within the startup community, we're like, yeah, Kaiser's got more pilots than Delta Airlines. And the challenge is, we all know one that's been successful and 10 that haven't been successful. What are startups doing wrong with you that they're not converting to become part of your care delivery system after the pilot?
Well, that's a good question.
Well, first thing, and I'll be candid, it's not always you. It's sometimes, most of the time, us. So it's really, it's really sponsorship and stakeholder engagement of how you approach it. And that's what I think that's really a strong point is you have to know who you're contacting and what their regional, local engagement looks like and how they're aligned to the national IT organization or the national, whatever it is. You want to get that in as soon as possible and first. I think that's the path to success. I think money can always be figured out for the most part if you have the right idea or the right plan, and then the technology better work. But yeah.
Great, thanks.
I like it. That was a good quote. More pilots than Delta. That was great. I think we're at our time in closing. I'll just say that Box has been working with Kaiser Permanente for some time, and I will say that Nico's been a wonderful executive sponsor, looking for executive sponsorship, and we were able to actually partner with Kaiser in a relatively fast way. We were able to get through procurement and security, and we're very grateful for that. But clearly we're a bigger company, we're publicly traded, we have lots of other large customers that are also working with us, but I have been relatively surprised and impressed at how expedient it has been to work with you. So it might just be your executive sponsorship. But anyways, Nico's information will be publicly available for all of you to hunt him down.
All right.
Thank you.
Thank